It is now making it. Yes. What I was asking you before was, what would be the most important part of what we've been talking about in the psychological, the restorative process? If you go to psychotherapy or drugs or other interventions, what would be the most important thing in the restorative process?
In my observational experience, admittedly limited, the most important element in the restorative process is, in fact, the relationship with the therapist. The drugs can facilitate this in some cases. Other technologies can be helpful. But ultimately, the processes of psychological restoration, of increasing the capacity for an emotionally enriched, interactive life with others, to increase one's psychological resilience, psychological flexibility, the ability to respond positively and effectively to the unexpected problems that will occur in any human life, is something which is produced through a relationship with the therapist, a relationship of confidence, respect, trust, and emotional safety. For many of these patients, and I'm thinking specifically of the ones I saw as a therapy provider for the city of Philadelphia, the context of therapy provided these men and women for the first time in their lives with a place of emotional safety where they could say anything without being presented with the anxiety of being belittled, being told they were wrong, but just emotional acceptance. Emotional acceptance is not behavioral acceptance. One has to be very careful with that distinction. One does not accept murder. I had one patient who had been convicted of a homicide. It does not accept being a drug dealer, a fair number of those. But there is an emotional acceptance of the human reality of that individual, and providing that acceptance is what is ultimately, I think, going to be restorative in the long term. Drugs can perhaps open a door to an individual about what kind of emotional life might be possible, but to maintain that, and learn how to process one's emotions, that is what the relationship does. One often talks about the expression and interpretation of one's feelings and emotions. What is important are not the abilities that are cultivated of self-analysis within the therapy hour, but the development of a generically applicable ability to understand and insight into one's emotions, which can be applied in the absence of the therapist. And that's one of the things that one hopes to produce with these people.
And would this come also with post-traumatic stress, where you've been through horrific things, that a relationship with a therapist could be restorable like that? Restorative.
Potentially, it is restorative. I mean, much of this is applicable throughout all of neuropsychiatric treatment, be it post-traumatic stress disorder, a major depressive disorder, generalized anxiety disorders. It's a place of safety, but I think this need for emotional safety is particularly important in the individuals who are experiencing post-traumatic stress disorder, because they experience the most profound loss of safety. And a loss of safety, a loss of control over their very existence is central to the creation of the disorder. And to provide that sense of safety once again is going to be potentially enormously restorative.
Would you use the word compassion, which I meet now very often with dealing with big problems and therapy, that you sort of work with the compassion for this person, and that would be one of the things you do in therapy? Would you use that word, or?
One certainly could use the word compassion. I think in myself, I think understanding, if one regards, compassion has so many elements that one has to be, and different elements are going to be important for different therapists and for even any given therapist within different therapies. Acceptance of the legitimacy of emotion, of another person's emotional reality, I think is the core of compassion. And it is the central first step in, I believe, an effective psychoanalysis or psychotherapy. The way you feel is the way you feel, and that is the only reason you need to feel that is because you do. That your emotional reality is accepted here. It may be troubling to you. You may wish it were otherwise, and we can, if you wish, work together to make that happen. But I think compassion is an acceptance and a projection of the acceptance of the legitimacy of another human being's feelings. Where again, very careful to separate the acceptance of emotion and not the acceptance of behaviors.